Are you guys all joining? Can you all hear me clearly, please? Give me a thumbs up. Hey guys. Hi Princess, Rimi. Morning Sarah. Hi Z. So there's a minute to go. Perfect, thank you. I just want to make sure that we are very clear. Hi Naila. Hello Dunya. Thanks Fatu. Thank you Lala. Okay. Morning Z. Hi Nasla. Okay. So, hi Abhidka. Good. Right, so I am going to start off and then we'll see whoever's joining can ask any questions. So a quick intro, I'm Riz. I'm a dentist who's been working in the UK, been here for about 15 years. I love dentistry and I love talking about teeth and dentistry. My mission is to make sure that people really understand and value the 2 to 3 millimeters of enamel that's been given to you. So this is just if even 2 people go away from this talk and you can look after your 2 millimeters and 3 millimeters of enamel that you have, I think that's mission accomplished. So what I would want you guys to do is just take note of these 5 things. All the problems on teeth, not all, I would have to say probably 90% of the problems in the mouth and teeth are completely preventable. Preventable as in the 5 things that you probably can have is, one is the biggest problem that everybody has is tooth decay. Tooth decay is very preventable if you look after it well with good brushing and avoiding sugars. Second problem, gum disease. Gum disease is very preventable if you, again, look after the brushing better. And if you can see a hygienist, again, no matter how well you brush, you still need a hygienist to remove any bits that you do not manage to clean properly. And the third thing is smoking. So these 3 things, you can completely prevent gum disease. Not completely, but most of the problems. Again, you get some problems like diabetes or some systemic diseases. You are more prone to getting gum disease, which we can't, obviously, again, diabetes is a very lifestyle control disease, but in general, okay, teeth wise, it's not completely in our control if it's a systemic problem. The third thing, and this is so important because people don't realize the problem. Princess, I'll ask if you can put questions on the questions tab. I'll come back to those questions because if you ask me in the comments, I might miss out on it. So if there's any important or any questions that you think that you'd like to join, ask in there's a questions tab. You please ask on that and I'll come back to this as soon as I finish quickly giving an update on teeth and what I think we can prevent problems, if that's okay, please. So we were talking about the most very prevalent, but what people are not aware is tooth wear. Now, so if you think about teeth as, so if you've got something precious, like if you've got like a treasure chest, imagine, yeah? You got a chest that protects all the treasures that's inside your chest. The same way with teeth, the enamel is what you see. All the white that you see in the mouth is enamel. Enamel is the strongest part in the whole body, really. The whitest part of your teeth. This is what is like your shield or your treasure chest. It protects what's inside. So there's 2 things inside. One is a dentine and one is the nerves inside. The nerves anything that gets past the enamel gets to the nerves, because what's just underneath the enamel is not that strong, so it can permeate into the nerves, and then that's when you start getting pain or problems or infection, all of those. So if the enamel can be protected, that is about 2 to 3 millimeters of enamel can be protected, whatever is inside is protected. How do we lose tooth enamel? That is very common. The third one I was coming to is tooth wear. Tooth wear happens in 3 types. Again, the most common is tooth wear from acids. You don't realize how much of acids that's there in your diet. So there's two things. One is acids coming up from the stomach into the mouth. That's very acidic. The acids from the stomach is about 2.5 to 3 pH in acid content. The other, which again can be quite medicationally controlled, you need to you can check if what is a normal pH, resting pH of your mouth, especially in the mornings, just to make sure that you're not getting silent refluxes. Because most of if it's a daytime, acids coming up, you will generally pick it up and you'll be able to tell. But what I'm more worried about is nighttime acids coming up, which you will not be aware of. So the acids in the diet, I'm going to go through a quick list, and you can ask questions later. So the acids in the diet are usually the biggest culprit these days is fizzy drinks. I saw a 15-year-old boy yesterday, such a sweet little boy. He's doing his GCSE mocks, and he came because he's had a big decay on one tooth. But the amount of acid erosion, the acids eat away the enamel, the whitest part of your teeth. Once it's gone forever. So if you lose your enamel at 15 years of age, so for an average, we live till 100, it's not going to last out. And that means you're going to be losing teeth. Losing teeth means replacement of teeth. Replacement of teeth is there's nothing as good as your own teeth, one. The second is nothing looks as good as your own teeth too. And third is it's so expensive. So I was telling that little boy, he's 15 years of age, each tooth. So if you want to replace each tooth, you have to know what that tooth value is. So for a replacement, for putting an implant in, which is like a fixed option. Implant is when you put a titanium screw into the bone and then you put a tooth on top. If you lose a tooth, that's one of the options. And that's one of the best options there is. That costs anything between 2,000 to 3,000 pounds per tooth. So you have to really understand and appreciate the God-given gift of your teeth, okay? So we were talking about the tooth wear. From tooth wear, there are 3 types of tooth wear. One is the acids we were talking about, and the acids in the diet is the biggest culprit. The acids in the diet, biggest culprit is fizzy drinks. Second is orange juice, orange squash, or any juice or any squash. Lime in water, lemon in water. It's considered to be very healthy for the body, and there's a lot of advertising of weight loss with lime and lemon water or with tea. And the issue is if you have any, all these food and drinks, you can have any of that maybe, once in a while, once a week, even none of that causes damage. Anything if you have on an everyday or every other day, that is when you will lose the enamel, because it's a very slow process. So think about it. 2 millimeters of enamel. How much do you think 2 millimeters is? It's not a lot, is it? And it just wears away. It wears away in microns or millimeter. But every time you have a repeated damage, the whole thing comes away. So I was going through the list: fizzy drinks, orange juice, orange squash, lime in water, lemon in water. As you can see, I have to go through the list. I do this almost every day with all my patients. Apple cider vinegar, again, big fad. People are having a lot of it for weight loss, health reasons. It's very, very acidic. Then all the energy drinks, very, very acidic, particularly Red Bull, Monster, all of those. So there's 2 things in all these drinks. There's acids and there's a sugar. Even if you have a sugar-free one, so like squash, for example, or if you're thinking, I'm having a sugar-free Red Bull, sugar-free Monster, sugar will cause decay. This we're talking about tooth wear. So whichever the fizzy water, so even fizzy water, flavored water, then there is all those health drinks like kefir, kimchi, then there's that other drink that we ferment, I can't get the name of it. all those are very acidic. Then obviously all the alcoholic drinks, wine, alcohol, beer, all of these are very acidic. What you can do is you can try and make sure that the least amount at least touches. So first thing is nothing on an everyday or every other day basis can damage your teeth. The second is that you can try and reduce contact. Can you reduce contact? Use a straw. Don't keep it in your mouth. So don't hold it in your mouth. And as soon as you finished your drink, rinse your mouth out with a bit of water at least, or mouthwash is the best. The best mouthwash that is out there is called Sensodyne Pro Enamel. It's a brilliant mouthwash. So another thing, the few things you can do, like if you're, for example, if you're having it with your alcoholic drinks and you don't want to rinse your mouth out, then you can just have a little bit of cheese. Cheese actually protects your teeth. So if you just, the biggest area that you can damage on your teeth is the insides of your upper teeth, and the whole enamel comes away. Again, it's not very visible, so people are not aware of it until it's really quite late. So just make sure that you probably rub a little bit of cheese, use a straw and that kind of thing, and then rinse the mouth out with a bit of water. Another very important thing is if you have anything acidic, so if you've got an acid reflux or if you had something like a Coke, make sure that you don't brush your teeth for an hour. So if you've had like a beer or wine in the evenings, don't brush your teeth for an hour, because what happens is your enamel becomes really soft, and then when you brush it comes away. So again, the tooth wear is when the enamel comes away. So there are 3 ways in which the enamel comes away. So we've just discussed erosion. Erosion is when there's acids in the mouth. The second is attrition. Attrition is when you grind your teeth or clench your teeth during the day, which you're not aware of. This happens a lot more than people are aware of. And the enamel where you bite, and that's what it's really important that you keep, because that keeps the height of your teeth, that keeps the height of your face. So it's really important where we bite, so we don't want to have unnecessary pressure going down the teeth. So that's called as attrition, or with tooth wear when you grind your teeth. The third thing, and it's quite common as well, is called as abrasion. Abrasion is when you use your toothbrush, for example, just imagine this is your toothbrush, you brush at that wrong technique, and then you scrub away the enamel, or the gums come away and your roots are exposed. It's quite common. But there are other types of abrasions. So people who do like stitching and sewing, if you got any questions, guys, I will come to the tooth whitening. Abdullah, can you please put that into the questions? I will be coming to the questions in probably a few more minutes, and then I can take all the questions. So if you just ask questions in the questions so I don't miss it, and not on the comments. So we were talking about, I've lost it. Yeah, abrasion with a toothbrush, but it can also be like any external abrasion. So if you're a person who is a sewing person, who holds don't hold things in your mouth. Teeth is not meant, or don't. And another thing very important, so that's what we're going to come to. So the 5 things. So one is 5 problems that we can prevent in your mouth. One is preventing tooth decay with reducing sugar. Just for people who have just joined, I'm just going to quickly, yes, Bruxism, Dunya, that's correct. Bruxism is grinding of the teeth. So I will come to that. The 5 things. One is decay. You can prevent with reducing the sugar, good brushing. Again, so in childhood we have a lot of decay, then it plateaus in adulthood because people are more aware of their teeth, they look after their teeth better, they can brush better, their sugar intake is reduced, they're more healthy. And then in older people, you start seeing again a peak. That's because the saliva in the mouth reduces. Again, saliva has a huge part to play in protecting your teeth. So drinking a lot of water is brilliant at all times. So that's about decay. The second thing is gum disease. Gum disease is triggered off mostly by not brushing your teeth properly most of the time, which is again completely preventable. With every type of toothbrush, there's a technique of brushing. I have actually done videos for each type of toothbrush, toothbrushing, interdental brushing, all of those. So just remind me if someone to tell you about interdental brushing. Then the third thing for any gum disease is smoking. Smoking causes havoc. It just drains away. So smoking causes, cancer, and, that's what's mostly concentrated on. But the gum disease, what happens is it's a slow process. Again, it takes about some people as long as 20 years to show some problems. But when you start smoking at 20, when you're my age, you don't still want to be losing your teeth. So then what happens is the gum starts coming away because you don't see any problems. You think it's okay. When the gum starts coming away, your bone's exposed, your bone comes away. What happens? Your teeth will slowly start coming apart. So you'll start seeing spaces coming in your teeth and you'll start noticing that. And then slowly the teeth become loose and fall out. So that's gum disease. Then we discuss the tooth wear. The fourth thing is fracturing of the teeth. So if you get, one tooth fracturing after the other tooth fracturing after the other tooth, that is mostly because of daytime clenching. So there's a nighttime grinding, so bruxism. So there's awake bruxism and night bruxism. Night bruxism is when all your teeth, you just, grind. It varies from person to person, so once a nighttime grinder, always a nighttime grinder. So you need to wear something to protect the 2 millimeters of enamel for your life period. That is nighttime grinding. So if someone's told you, or you grind your teeth, you've got to wear a mouth guard for life, because it always happens in episodes. So you might have 2 weeks of grinding and then not grinding for 2 weeks, 2 months, 2 years, 20 years. We don't know. But you got to, because you go back to it at any point, it is very related to stress, but it can be because of lack of sleep, how tired you are, alcohol, hormones, medication. So it's always an episodic, so it's very difficult for you to judge when you go back to it. So once a nighttime grinder, always a nighttime grinder. But it's very unlikely that grinding at night causes fractures of the teeth, like catastrophic fractures that you'll have to remove your teeth. What happens when you sorry, I was just getting distracted by one of the comments. Sorry about that. So what happens when you do a daytime clenching? That's even more. What happens is your teeth are supposed to be in contact only for about 5 to 8 minutes a day. So that if you guys say M and close your mouth, M and keep your mouth closed, your tongue to the roof of your mouth, teeth apart by 2 to 3 millimeters. That is how it should be normally. Teeth contact for eating for probably about 5 to 8 minutes in a day. That's all you need your teeth contact for. So anything more than that, you're causing damage to the teeth. So just remember that. People do clenching. What happens is when you clench during the day, you keep putting lots of forces down the teeth, and then you it's a very subconscious thing. You realize, oh, there's something that's loose, or oh, this feels, and then you find a weak link, you keep working at the weak link, you'll break the weak link, then you go to the next, and then you go to the next, and that's the problem with daytime clenching. So tooth fractures is usually from daytime clenching, so it's very important that we make sure that we identify it. Identifying it is really, really hard during the day. So you will not hear any noise, unlike the nighttime grinding. So it's like this, just putting forces down the teeth. So check if you got it's called subsurface craze lines. It's called craze lines. It's just subsurface cracks. And that's actually the fact that there is a lot of forces going down the teeth. Again, if you've got lots of fractures, just keep your eye out. People usually clench during 3 things usually. So when you're obviously doing like weight training and things like that, or if you're in a job where you got to do a lot of weights, or sometimes it can be when you are in a concentration, a lot of computer work, people who are doing a lot of paperwork, so like accounts and things like that, they're looking at numbers. All of that is another common time when, or children, video games, all of those, when people concentrate a lot. I've seen that there's a lot of fractures, like daytime clenching. The third thing is when people are like going to autopilot. So it can be anything though. That's the saddest bit. So it can be like as entertaining as, golfing or something like that. Or it can be when you're running, again, weight training, gym, cycling, all of those. When you're basically going to autopilot. So you think about something else than the thing that you're doing. So it can be when you're cooking, gardening, it can be anything, but it's figuring it out. And daytime cleansing is about habit breaking. So unfortunately, you can't just wear your mouth guard all the time. So then what you can do is you need to first identify it, diagnosis, which is very, very hard. And then is stopping the habit. Stopping the habit's really hard. So there's lots of studies. Some studies say as little as 17 days for a habit to form, 17 days for a habit to break. And then the other extreme end is about 254 days for a habit to form and 254 days for a habit to break. So somewhere in between, some general guidelines now says about 67 days for a habit to form. So you got to keep repeating it 67 days. So for a good habit, particularly, obviously, if it's a bad habit, like, something that you enjoy, like having a chocolate, that's an enjoyable thing. But it's a good habit. It takes a long time to cultivate. And breaking a bad habit, so like stopping smoking, it takes up to 67 days of. But in saying that, in my career, for what I've been 19 years, all the people who have quit smoking, so any of you in this group who does smoke, if you would like to quit smoking, there's only one way to quit smoking, and that is just throwing your cigarette out of the window and saying, this is the day I'm going to stop smoking. I haven't seen anybody reduce their smoking into vapor. So that's the 5th point: prevention of all the problems like gum disease, bad breath, oral cancer, all of that. Those other extras is usually because of habits like smoking, particularly any drugs, marijuana. All those make you feel like having a lot of sweet things. So again, these can cause a lot of damage. So just be careful with the habits that you have. So these are the 5 things that you can do. These are the 5 problems that the teeth are affected with, or teeth and mouth are generally affected in all my career, and all of this are 90% preventable. So hope that helps all of you. I am happy to take some questions now. Any questions? Yes. So let's see. So the first question is from Sarah. Sarah asks, hi Sarah, hope you're doing good. Is the hidden sugar in raw honey considered as natural fruit sugar? How does it affect your teeth? It's a very good question. So honey is actually fructose. So there is different schools of thought with fructose. Fructose is considered to be the healthy honey, which is what you find in fruits. And the advantage of having fructose in fruits is that fructose is intracellular, that means it's inside the cell, so it doesn't come in your mouth and damage the enamel in the mouth. But when fructose is digested, it turns into sugar. The fructose, the corn syrup, corn sugar, the syrup version of the fructose, I can't get the fructose sugar. Anyway, that's got about 50% of its fructose, and that's very damaging for the teeth. Now, honey particularly has got the 2 problems with the sugar is that it's like added sugar. The fructose is in the form of added sugar. So it is available to the bacteria in the mouth to digest. So it can cause a lot of damage. High fructose corn syrup. Thank you, Sarah. That is what I was looking for. And the second thing with honey is that most people have honey with their breakfast. When they have it with their breakfast or something for healthy, they have it with lime and honey, all of that. And what happens is it stays on the mouth. It's not washed away very well with saliva. It's quite thick. And so that means, as you know, the teeth are not smooth. Teeth has got a lot of nooks and crannies. It goes and gets stuck in these nooks and crannies, and you can't wash it away, or you can't, get rid of it. And that causes, it's like having sugar all day. It just stays in these nooks and crannies. So that's the problem with honey, and that is why honey is very, 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 very potent in causing decay. And so for that reason, I wouldn't recommend having honey in your on a daily basis at all. How does it affect your teeth? It causes decay. Yeah, so it stays on your teeth and it can cause decay. Hope that helps, Sarah. Right. Next question. Yeah, Princess. My teeth are normally having a little yellowish shade. Which material could be applied for whitening it? Okay, so whitening, whitening is a procedure where we bleach the teeth. So like you have hair color, skin color, eye color, there's a teeth color. Everybody's got a teeth color. The enamel is a particular color. it depends on how thick your enamel is, just again, what color your enamel is, and also, and how thick your enamel is basically. So it varies from person to person. The whitening has to be, there's only 2 components, and now there's possibly a few other components that I'm not aware of. I mean, there's a High Smile which has PAP as their active ingredient. I'm not sure, but what we usually use in the dental surgeries or whatever is available as like over-the-counter whitening products, there's carbamide peroxide. Carbamide peroxide breaks down into hydrogen peroxide. And these two, so there's hydrogen peroxide, it's available either as hydrogen peroxide or carbamide peroxide, and you can use either of these for whitening. These two do not cause any damage to enamel. There is plenty of studies. What it does is just goes into the tooth, breaks down any stains or coloring or like any, like if there's been any bleeding, into all that is broken down, and it changes the color of the teeth from the inside out. The thing is, this is like, how you color your hair, or you've got to maintain it. So you got to do it probably every 6 months, every 9 months, depending on, so it doesn't just stay, you can't just whiten it. It doesn't stay like that. I mean, for a lot of people, it does stay quite well, but it varies. And I've seen very many different types of relapse and everything with whitening. So I would say these are the 2 safest ways. So there are these whitening strips. So how we do it in dental surgery these days is that we make these whitening trays which fit very well into your mouth, and then we give you carbamide. So in the UK, so when it's a EU derivative regulation really, that we cannot use more. So we used to, when we started, we used to use 22% carbamide peroxide. But now in the UK, we can use only 10% and 16%, which breaks down to 6% of hydrogen peroxide. And so we put the gel in the tray, and then we use it every night or every other night, depending on, sensitivity. The only possible complication or problem that you can have with whitening is that it can give you sensitivity. So, basically this happens usually when the enamels come away, and what's underneath the enamel is called as dentine. Dentine's exposed, but it just basically makes the enamel a little bit more porous to temperature and all of that. So, but it is very transient while the whitening is happening. I've done whitening myself about 3-4 years ago. I did just my tray. Got trays made and just did tray whitening. There is a lot of, spam, which says that, you can use light to activate the whitening gel. All of that is just a lot of gimmicks. Basically, none of that works. So I wouldn't recommend any of those light whitening, any of that. Tray with gel is the best way. But if you want to get one of the over-the-counter, like strips, carbamide peroxide strips, all of those are quite good as well, if that's something you wanted to have. So those are the bits about the whitening. So now another thing, so the whitening toothpaste and all of that, think of it like this. So it's like having, when you have a dirty, for example, let's say, what do you call those, non-stick pan, okay? It's very dirty. You will not take your silver scourer to it, will you, to clean it? It's the same thing, Enamel is a coating on the teeth. If you are a person who gets a lot of stains that stay on top of the teeth, so like they actually target smokers, and I hate it because there is smoking stains that stay on top of the teeth. So people who drink a lot of coffee or red wine, it's quite common in all these people. The stains are surface stains. So again, like the quality of enamel for each person is very different. So some people have enamel that absorbs the color that comes its way. Some people have got very hard outer enamel and it doesn't take on any stain. So it's like, think of one as like a cotton shirt and one like a polyester shirt. It doesn't take on, it's the same way. So some people take on the color and it doesn't take it in, it just keeps it on the surface. So you get surface stains. What the whitening toothpaste promises to do is, it's what the silver scourer would do on your non-stick pan. It'll scrub that first, the dirt, but it'll also make scratches on your enamel. see the components, so there are different abrasive components that's added in toothpaste. The component, the additive value of all the components that are abrasive in a toothpaste is considered as the relative dentine RDA, relative abrasivity, RDA. The RDA should be in a healthy mouth, it should be about between 70 to 100. Healthy toothpaste should be about 70 to 100. Most of the whitening toothpaste are over 100. The maximum by the American Dental Association, ADA, which makes regulations for toothpaste and which is what everybody follows, is it's 200. So anything more than 200 is not allowed to be. So what RDA does is, like, just think of it like a silver scar. The more the abrasivity, the more you're scrubbing the enamel, basically to get rid of the surface stains, and that only causes damage. So I wouldn't recommend that you use a whitening toothpaste at all. If there is a lot of staining in the mouth, I would recommend that you go see a hygienist. Their ultrasonic scaler itself can remove quite a bit of the stains. And the second thing that you can do is go, and there is also an air floss. That means like a polish, but in an airflow machine that just takes off all the stains as well. So these are two things I would recommend for you to get rid of any of the surface stains. So hope that helps you, Princess. Okay. So we've got Paresh Bothara. He's asked treatment for gingival recession. Abdullah, I've just answered. I hope I've answered the question for your teeth whitening. So yeah, whitening, the best would be to go see a dental. The thing with teeth whitening is that, you know, these people who just give you teeth whitening over the counter, they don't know what is wrong with your teeth. So if you've got a tooth that has got a little bit of a decay, or it's very close to nerve and it's going to be exposed, and then you use tooth whitening on that tooth, you actually kill that tooth. Because then, so healthy, when there's enamel, when you're whitening enamel, it causes no damage. But if the nerve is exposed or nearly exposed, you don't know it. And so it is important that you get a dental checkup. So cosmetics on my list, if anybody comes to me for cosmetic dentistry, that will be the last thing that I will address, because health of the teeth, it has to be all cosmetics. So whitening, veneers, orthodontic, all that is done for people who have healthy teeth and mouth. That means whatever we do will not damage it more. So that's why I wouldn't recommend any of the over-the-counter medications and do any whitening after speaking to a dental professional, or any cosmetic treatment for that matter. So treatment for gingival recession. Again, that's like talking about Indian politics. It's a day's topic really. But so gingival recession mostly happens when what happens is there is bone that holds the root. So my hand is the tooth, and this is the root. My arm's the root of the teeth. There's bone till here. With age, the bone recedes a little bit. If you have treatments like braces to move the teeth in the bone, there is risks of some bone recession. Gum disease is the biggest causative factor for bones receding on the teeth, which is almost always because of poor brushing, smoking. These are the two biggest causes of gum disease. What happens with the gum disease is the gums are attached to which is what protects the root of the mouth. It's attached. There's a lot of fibers between the tooth and the gum, the root and the gum. The smoking and plaque sits into the gums there, which irritates the gums, make it red and inflamed. The gum slowly comes away from the teeth. So more of the plaque can go into the teeth. So more of the tooth comes away, and then slowly reaches the bone. The bone slowly starts to come away. Your teeth splays first, and then it becomes loose and falls out. So that's the smoking or the gum disease issue. Gum recession is usually because of something where your gums and the bones are coming away from the teeth. I have seen quite often also incorrect brushing technique. So incorrect brushing technique, either with a manual toothbrush, which is the most common. So for that reason, so again, there is evidence to say that the adult, the electric toothbrush works about 5 times, don't quote me on this, but 5-6 times better than a manual toothbrush. But my biggest issue more than that is that the wrong technique of brushing causing damage of gum recession, and the gums coming away, and then it causes notches on teeth. So I do have some photographs I might put. Actually, there's a video I've done just because of the PDL fibers. That's correct, Paresh. So the PDL fibers comes away. I didn't want to use too many technical dental terms. So when the roots are showing, roots are not meant to be in the mouth. It's not meant to be like enamel where it takes on any forces. So it comes away, and usually you see notches on the root. Again, the problem with the notches is, patients are told, oh, you brush too hard, and then they don't brush enough. So then there's notches which collects the plaque. The gums already come away, and then they start getting, so every time you leave plaque at near the gums again, it's like, normal human reaction, just want to shrink and protect itself. Gums shrink, and then the roots are exposed, and then you get problems. So that is gum recession. So you asked so that's the causative factors of gum recession. Unfortunately, the treatment options for gum recession is Tahir-Mida. Sorry, am I saying that correct? Maida, sorry. The treatment, I'm just coming to that. You also asked the same question, treatment for gum recession. Guys, if you got any questions, please ask in the questions comments so I don't have to go back on the comments to check it. I will check that. I'm answering from those there. But yeah, I'm going to go for gum recession. The treatment options are very difficult, and so one's teeth, so enamel, dentine, gum, bone, any of these goes. Replacement options are false replacement options. So if teeth enamel goes, you can put white fillings on them or silver fillings on them. If the dentine goes as well, we have got a replacement. If the gum goes, we have to do a free gingival graft. A free gingival graft is from the top of the palate, we can take a bit of gingival material and put it on wherever you've lost. It is done by specialist periodontist. I'd strongly recommend that you get it done properly. It's a very questionable prognosis. It's very difficult to get very good prognosis because you got initial gum disease because you don't brush your teeth properly or because you're a smoker. So you have to really eliminate those causes if you want a graft to take. So it is quite a hard procedure because once your bone level goes, so if your bone goes, like if you get holes or like we call it pockets in between the two, those can be like sort of filled. But if your level of the bone goes like this, horizontal bone loss, we call it, like this, it reduces on all of the tooth. We can't build it back up. It's really, really hard to get even bone grafting. All of that doesn't stay very well. So if you lose a lot of bone and your gum recessions from that, then that's the issue. It's for life. So the only thing you can do is maintain wherever you lost the gum and the bone till, you've got to maintain it there. How you maintain it? Seeing a specialist periodontist, if that is an option for you. Wherever you are, go see them and speak to them and see what, again, I'm not a specialist in that field. So, there are lots of different other gum recession treatment techniques actually, wherein it's called, they advance the flap. So it's a proper surgical procedure where all of the gums, so if I had gum recession, for example, all of this gum is elevated into a flap. That means it's all taken off very gently. These are very friable, so it has to be done by people who really have got excellent surgical skills and know what they're doing. And it's brought forward. So the most common area where people lose gum is right in the lower front teeth. So it's called gingivally replacement flap. So move the gums forward. Then there are many procedures where it's relieved from there's a few techniques, I can't remember all the name, where the gum is relieved and it's relieved from the instead of having a full flap, and gum or gel or bone is inserted and then brought forward. So there's few different procedures for gum recession. Again, you will need to see a specialist prosthodontist, but it's all quite complicated. It's for people who are very motivated. You have to give up your habits if you want it to work. And again, best thing is prevention if possible. So hope that has answered your question on gingival recession. That's it. Princess Rimi is asked, how much for the surgical crown lengthening procedure to be completely healed? How much time? I'm assuming you're asking how much time. So crown lengthening procedure is when, it can be for either aesthetic correction, mostly for aesthetic correction. So where the gums have, come down, or, there's different levels of gum levels in your mouth, then we can correct it and make it symmetrical. That's called a surgical crown lengthening. Or if you've worn the tooth down so much that there is not sufficient tooth enough for us to put any crown or veneer or anything like that on, then we remove the gum onto either the root or sometimes the gums would have overgrown. Whatever the reason, we remove some of the gum or we push the gum up so that the teeth are more visible. Any procedure, so there is studies, lots of different studies done. The most common consensus is that you need to leave it at least 6 months so that the gums mature after crown lengthening before you can do any different. Because sometimes the issue with crown lengthening is sometimes the gums grow back. Sometimes when we do some treatment, it can recede more. It's has got its own risks. So it is very important that before we proceed with any restorative treatment, that we leave it for at least 6 months before we proceed with the recession. The crown lengthening before treatment can be done. I hope I've answered the question, and I hope that's what you asked. Right. So we have discussed teeth whitening. Is there any treatment for white spots due to dental fluorosis? So, so there is a lot of so white spots can be usually caused from fluorosis, but it can be from the enamel not forming properly. The fluorosis can be corrected with, so there is different techniques. So one again, it depends on how badly a tooth is damaged. Fluorosis also fluorosis happens when there's high fluoride, when the teeth enamel is forming. When the enamel is forming, it doesn't either calcify or form properly. If it doesn't calcify or form properly, sometimes if it's mild, it shows as white spot lesions, as you have said. Or what it can do is it can be so damaged that it becomes so porous that the stain starts seeping in, or the white lesion can become worse if it's a super decay on top of it and eating away the acids, causing damage on the enamel and makes the enamel more porous, that it takes on the stains, and then the white spot lesion slowly changes into a brown spot lesion. And then a brown spot lesion, if the bacteria and the sugar is not controlled, becomes softer, and then it becomes a hole. So so in fluorosis, it's a so that is usually a white spot lesion. So white spots can be either decay or hypoplastic, that means enamel not formed properly. Fluorosis, it can be many reasons. If it's fluorosis, it's usually because it's actually quite, the fluoride has made the enamel quite strong. So it's not as resistant to acid dissolution and you'll not get as much decay. But correction is a bit, it varies from person to person. So in my experience, I've got good results and okay results. So my protocol for treatment with fluorosis would be, first I would whiten the teeth, because it just kind of helps. So the problem with whitening is that these white spot lesions look even more whiter. But the advantage is that it just kind of helps us. If it needs more treatment, then it's just all similar color. So that really helps, instead of having one yellow tooth, one brown tooth. If it's all different, so whitening really helps to sort of even out the tooth. And if these white spot lesions become much whiter, so that's something I warn the patients. Most of the time it just settles down, but sometimes if it doesn't settle down, then there are probably two options that we can go from there. One is remove the white spot lesion or the brown spot lesion and, you know, replace it with some filling material. The second would be to, there is a treatment called as Icon, which I do quite often. I do have some pictures of a patient I've done fairly recently, young patient. So this is what I would recommend for anybody who's young, who wants cosmetics or, you know, looking at cosmetic options. Instead of putting fillings on, that'll be our last option. Fillings and veneers would be our last option, obviously, for a young person. Icon is where it's an infiltration of the resin into the hypocalcified areas and kind of filling that in so that there's not as much. So it's basically more light passing through and reflecting from that area, which is giving it white. So we sort of fill it with resin. It's called as an Icon, I-C-O-N. I shall actually put it on the chat so you guys can go and check it. It's a product that is produced by DMG, and it's a brilliant product. So that would be my two options for treatment, obviously after whitening, either a filling if it's really deep. There is also something called a surface abrasion. Again, it depends on how, so the enamel is formed in layers. It depends on which time so the enamel formation was affected, and so depending on which surface, if it's a very deep lesion, nothing works. But if it's a fairly surface lesion, again, that's called as acid abrasion, where we use I can't remember exactly which acid it is. It's an abrasive acid that we use that's given by Tricare. I can't get the name now, where we just use a polishing scrub and just sort of scrub it, and that again reduces that white spot lesion. Again, it doesn't, not for every case. It's very difficult. You need to judge it. Even when you've seen many cases, you still may not get it right, because every enamel, every person's tooth enamel, you know, reacts differently to it. Right, so I have got a question from Rihan. Which toothpaste would you recommend for improving gum health? So gum, perfect. It's a great question. Oh, just before I come into that, can Icon be used in Leo's case? Yes, I think so, but it's again too difficult, and it's not really advisable to think of any cosmetics for young children. I would say I would definitely delay it as much as possible, because, you know, teeth need to form fully. We need to know the extent of if it's affecting other teeth, all of that before we can decide on treatment. So I wouldn't jump into treatment of our little Leo yet, but I think we can look at Icon. You know, Icon causes no damage, so we can look at Icon for treatment of, for white spot lesions. Yeah, hope that's okay. So that was just because we're just discussing Icon. Let's come to what is good for improving gum health. Gum health, so the toothpaste industry is a big gimmick, okay? There is only one component in toothpaste that has been found evidence-based to say that it protects the teeth, and that's fluoride. Almost all toothpaste in the UK are it has got 1,450 ppm of fluoride, which is the adult concentration. Children's toothpaste should have 1,000 ppm of fluoride, and that's the only ingredient that's important. Sensitive teeth, I know there's someone who's asked about sensitive teeth. Sensitivity is the only other time that I would say sensitivity, and then a higher fluoride. Those are only two times that I change toothpaste for people. The sensitivity toothpaste works. Every sensitive toothpaste works in a different way. I've done a video on sensitivity. Please go and see that, because that explains it a lot better. I don't have time to explain all of it. Sensitivity happens when the enamel comes away, and what's just underneath the enamel is called the dentine. Dentine is in the form of millions of tubules. It extends from the enamel on one end, and there's a nerve on the other end. So once the enamel goes, these tubules are exposed from this side, for example, and the other end of the tubule is your nerves. And so what happens is, when you have a sensitive toothpaste, is if that's your tubule, it just goes so just as normal brushing, it just blocks off these tubules anyways. But if you use a sensitive toothpaste, it forms a bit of a bond, a chemical bond is formed. So the way the Colgate sensitive works is completely different to how Sensodyne works, is completely different probably to an Arm & Hammer sensitive toothpaste. So the chemical bond that is formed is what will protect the nerves inside. This bond takes about 2 to 3 weeks for it to form, and continuous use is what it'll form and reform and maintain it. So you to start seeing some results of the. If you guys have got any questions, if you put in the questions, only then I'll be able to see it. Otherwise, I will not be able to scroll back and check the comments, please. So you will need to. Sorry, you were saying, yeah, so it needs, so if you have, the only time this chemical bond comes away is when you have anything acidic in your mouth. That comes away very easily. So almost always a sign of sensitivity is a sign that the nerves are exposed, and this block on the dental tubules come away. So sensitive toothpaste work like that. If one sensitive toothpaste works for you after 3 weeks, that's your toothpaste for life. You can't change from, like getting a good deal from one Sensodyne to the, it doesn't work like that. If it's one toothpaste, a chemical bond, so it has to be replenished, and that's your toothpaste for life. That's the only time that I'd recommend a different toothpaste. The second time I'd recommend a different toothpaste is when you got high decay. We recommend Durafat. There's 2 different concentration of Durafat we prescribe. 2,800 ppm of fluoride. That's double the adult dose, and 5,000 if the person's got a very, very high decay rate. For gum disease, so there's a lot of toothpaste that really stays well to the gums and protects it. So like there is the chlorhexidine one, the Corsidil one. Then there's loads, there's loads of toothpaste in the market. The issue with all of that is, so there is an advantage. So for Corsidil toothpaste, there's an advantage for someone who's having gum treatment and during the treatment. But if the problem with the Corsidil toothpaste, for example, it stays so well to the gums, it protects the gums. So Corsidil or any toothpaste that contains chlorhexidine gluconate is what I'd recommend for gum health. But we need to be very careful. So it stays so well to the gums to protect the gums and it's antibacterial, but it also stays on top of the tooth. So toothpaste you're supposed to use and spit out, and don't rinse your mouth out. If you rinse your mouth out, you're rinsing the good fluoride away. So you got to leave it in. So then if you leave the Corsidil in, it sticks so well to the teeth as well. Any color that comes its way. So it can be red wine or colored food, teas, coffees. It stays on the teeth. And then so I see a lot of people who use Corsidil mouthwash or Corsidil toothpaste as having gum, for their gum disease, as having stains. So you got to be very careful for those reasons. I would say, again, you will need to see a professional and make sure that if a toothpaste or mouthwash, everything is particularly correct for you, because there are so many out there, and you got to see what works for you. But as for gum treatment, it's not about the toothpaste, it's not about the toothbrush, it's about brushing your teeth really well, using sufficient time and sufficient technique. The most important thing is sufficient time, sufficient technique, the correct toothbrushing technique for the tooth. There are 3 different types of toothbrushes you can have. One is a manual toothbrush, one is, and the electric toothbrushes, there are usually 2 types. One is the Sonicare. So Sonicare is, all the toothbrushes in the market now are Sonicare, because the patency from Philips ran out about a couple of years ago. And so all the toothbrushes are Sonicare. And the Oral-B has got an oscillating head that is patented to Oral-B. I recommend the Oral-B. I use an Oral-B myself, and the toothpaste does not matter. Toothbrush really, again, whichever toothbrush you can brush well with, whichever of these, it's a technique. Techniques are given in some videos previously, and I think the whole video is on YouTube. I don't think on Insta at that time it was full of the whole videos were uploaded. But so that's that, Rehan. Hope that helps. So just, you need to brush better. Toothpaste doesn't have that much of an use. We've covered sensitive toothpaste, Lumlu. I hope that helps. Do you suggest pit and fissure sealants on all molars for high risk? Yes, absolutely, Sarah. For all children who've got decay in their milk teeth, 100%, I would recommend that all the children whose adult teeth start erupting, especially your molar teeth start erupting from the age of 6, have their molars fissure sealed. I would do it even for children who do not have not high risk, but definitely for high risk children to basically molars have got a lot of nooks and crannies, and to protect that 100%. So most adults, the most commonly lost tooth due to decay is your first molar teeth, which erupts at the age of 6. And so strongly recommend. And so most strongest teeth, it's what keeps the shape of your face. It's the anchor in which all your, like when you do braces and things, is the most important teeth. So really good idea for you to protect that teeth. I'm just going through the questions and making sure I've not missed any. Okay, so Amir, you've asked a question. How important it is to replace missing teeth? Obviously, I'm a specialist prosthodontist, so I specialize in replacement of missing teeth. So obviously, I think that it is super important to replace the missing teeth. So what happens with teeth is that it actually maintains the shape of your face. It's not very obvious, and it does not show up very quickly. So the height of your face, this 1/3 should be equal to this 1/3, should be equal to this 1/3. Okay, from your hairline to your nose, and so this is very important. So if you have tooth wear, your teeth, and then this happens, so that's when you start having dentures, or when your teeth wear. That's one. Second is actually if you lose a tooth, and if you actually don't for my patients, when they come in, they don't see that. Their cheeks start going in like that. You start having, and those things are irreplaceable. Even if you replace that tooth, these soft tissue changes because the muscles work in a funny way. So then if there's a gap in the mouth, you have your tongue, actually, it just grows into that area. Your cheek grows into that area. So even if you replace the tooth gone, these things, soft tissue changes, you can't really change. The second thing is that if you don't replace the teeth on either side, so there's an opposing teeth that's not supported up, so it starts coming down like that. The teeth on either side, so that's the teeth that's missing in between. These teeth slowly, it's not a fast process, a very slow process, they start moving into the gap. What happens is, then what happens to the occlusal, where you bite, changes. So it changes your bite, it loses bone on these teeth, they lose support. So it's like an extraction cycle. You start with one tooth which you have extracted and you've not replaced. It's like you can start seeing signs, Then what happens is, when you lose one tooth, you can't chew on the area. Chewing is a big reason why your teeth are kept clean. So when people don't chew, or if you got like a decay, people don't chew on that area. And then what happens, instead of having one tooth that's lost or having a decay, other teeth start showing problems because you don't use that side as well. Then the muscles in this area don't work, and it's just like cascading effect. And you just see people having so many problems because of having lost a tooth. So yes, I would say, as a dentist, prosthodontist particularly, that a replacement of a missing teeth would be quite crucial. Again, especially if you are young. Yeah, if you're young. If you're young, you should also consider if that's a tooth that you can take, if this tooth that needs extraction, maybe extract it and then, maybe do braces to correct it. Again, these are things you can consider. But again, you will need to see, it's very specific for each person. So you will need to see a specialist a dentist, dental professional to make complete decisions on how you'd like to proceed. So I think we are coming to the end of the session anyways. I'm just quickly checking if there is any other questions. Best and healthiest ways for whitening, we've done that. I think that's it. All the questions have been answered. So that's been a great session, guys. Can I have a thumbs up to see if it has helped you all in any way? And I will be putting this live up as well. So if anybody wants to check it out, or if you want to ask any of your friends or family to, it's great information, so they can have check it out. Yeah. Thank you, Z. Thanks, Sarah. Thank you, Naila. Thank you, guys. Thanks, Amir. Thank you all for coming and supporting me. That's awesome. Thank you. When is the next live? I haven't really thought about it. This is because I reached 1,000. I realized on TikTok you need to have 1,000 followers to go live. So I just thought it's just great that I wanted to go live. So I haven't really thought about it, but yeah, let's see how we get response from this, and I might go live maybe once a month. That'd be nice, isn't it, to answer some questions. Yeah. Thank you, everybody. Thank you, everyone. Thanks, Sarah. Thank you. Thanks, Lulu. Lumlu. Thanks, Rehan. Thank you guys for all the support. Great. Yeah, any other questions, do feel free to, thanks Abidka, please do feel free to send me a message.